Welcome back. May is Mental Health Awareness Month. As you can see, we got the studio lit up green today. We're both wearing our green pins here, and we have a special guest with us today. Brandi Christiansen is President and CEO of Mental Health America, Wabash Valley Region. Thank you for joining us today, Brandi.
And thank you so much for having me.
All right, and we're going to start off with talking about what is kind of a fairly new resource. It's the 988 crisis line. So can you tell us a little bit about that?
I can. So 988 basically was a federally designated number. FCC back was enacted in 2020, and it's had a bit of a journey to implementation along with some legislative pieces as well. But it went into effect. In other words, by dialing 988, you could actually connect to what was formerly the National Suicide Prevention Lifeline, and that began in July of 2022. But it's just phase one of what 988 is supposed to be.
Okay, so what do people need to know if they're in a crisis and they, need someone to reach out to? They're thinking about doing this hotline. Obviously, you need to dial 988, right?
You got to dial 988, and it's good to know what to expect. So you'll be prompted. There's a prompt for Spanish-speaking callers and a prompt for veterans. And then you will be connected to a trained crisis specialist. And this is someone who has had some training and is employed to listen to your particular crisis and help you walk through some sources that you may or may not be aware of for help. If you are in danger of suicide ideation, they'll walk you through a suicide risk assessment, and then we'll help you formulate a plan to keep you safe for now and give you resources to be able to get the help that you need when you need it. And if that help is right now, then they're going to help you get connected with someone to get you in a crisis stabilization unit.
So what's the idea behind 988? Is it making it just as simple as possible for someone to get that help that they
You got it. Look, there are so many barriers to people getting help for their mental health, whatever reason that is. Stigma plays out in various different ways, even throughout legislation and policy. And so people are very reluctant to get early intervention help for mental health and addiction. 988, the entire system is designed to remove barriers. And, if there's one thing that we hope by having all of this attention drawn to this month and being given this platform, this opportunity, is that people don't wait until it's a crisis to get help. So the most important thing to remember is that mental health disorders are just like any other disorder. So early intervention improves outcomes. And to that end, Mental Health America has a plethora of services for wherever people are at in their recovery journey to help them get started. Because it can be daunting, but it takes a lot of courage to take that first step. So 988 is the crisis response piece. And we are revolutionizing what that looks like for people so that it won't always be something scary and intimidating for them to enter into. But also, people should remember that there are free anonymous online screenings on our website in case they're starting to feel a certain way. Get help then. Or if they're, starting to see things in a child or a family member or themselves, and they can get the earlier intervention through our Navigator program that will connect them to all of the community resources that we have. There's peer support, there's support groups, there's education. The sky's the limit. We're talking about it. Let's not stop there. Let's get people plugged in.
Okay. Well, that's all great advice. Thank you so much for joining us today, Brandi. We really appreciate it.
I really appreciate the opportunity to talk about it because, everybody deserves the opportunity not just to survive, but to thrive.
Okay. Thank you, Brandi.